Okay, so with agonists versus antagonists, we study these effects and what they are in the neuroscience chapter. And the reason we study that is because when we talk about agonists versus antagonists, we're usually discussing how they affect neurotransmitters. So real quick, we're just going to review what neurotransmitters are. So neurotransmitters are basically chemicals that are passed in the nervous systems to communicate signals. Now, when we talk about different neurotransmitters, some examples are serotonin, dopamine, acetylcholine, etc. There's about 8 in the Psych 111 course that we try to get you to get, but these are the 3 big ones that I look at. So all of these have different effects on your body. If you have extra acetylcholine flooding through, what happens with this is your fight or flight is part of this. And so if it gets too high, then your fight or flight system kicks in and you're going to respond to a fearful situation. And if there's not enough, then you might not have too much of a reaction. So what agonists do is agonists increase the flow of neurotransmitters. So if any of the neurotransmitted chemicals such as serotonin, dopamine, and acetylcholine aren't really getting through to the extent that they need to, and you're seeing psychological or physical problems because of it, then they will give you a type of drug called an agonist. And an agonist just increases the flow of that neurotransmitter, makes it easier for it to go through, and puts a little bit more in there, that way that you'll function a little bit more normally. Now, antagonists, think of anta as more like anti, and that'll help you remember. What these do is these decrease or block the flow of neurotransmitters. So sometimes when our body's trying to do too much, it'll pump out too many neurotransmitters, and that can cause physical and psychological problems as well. So they'll use a drug called an antagonist to almost set up a barrier so that not all of that neurotransmitter can get through. So for example, one of the ones is endorphins. This is a neurotransmitter. So endorphins are almost like pain blockers that happen when you're exercising, that they bring in the pleasure so that you'll keep doing the exercise. So if you're not getting enough endorphins, we might give you an agonist specifically designated towards that in order to make it so that you can exercise more comfortably.